Hello, everyone. My name is Kennedy Fletcher, and I will be debriefing Miss Felicia's case today. I first want to start off with I have no direct aspect of Miss Felicia's life that I personally relate to. I don't have any experience with foster care, and I don't have any children. So I know as I approach this case with Miss Felicia, I know I need to be very intentional in how I build rapport with her. My approach would be to lead with empathy, respect, and non judgment. Miss Felicia has experienced a lot of trauma, loss, and instability, so she may already be feeling blamed, ashamed, and afraid, especially since her children were taken away from her. So, in order to build this rapport, I would need to speak calmly and clearly with Miss Felicia. Of course, avoid judgment or blame. Listen more than I talk. Me listen more and let her talk, and to also validate her feelings, even if I may not agree with her choices. I would let her know that I acknowledge her concern, and I will let her know that I understand that getting her kids back is really important to her at this moment, and I want to work towards that goal with her. And I just would do that to let Miss Felicia feel heard and understood, which also is the foundation of trust. So next, with Miss Felicia's family history, it includes multiple traumatic experiences, and that strongly contributes to her substance abuse. So first, she experienced abuse at a very young age, between the ages of 3 and 5, and even more, which is even more damaging, her mother did not believe her when she tried to tell her. So inside, Miss Felicia has felt deep emotional pain, shame, and feelings of worthlessness. Second, Miss Felicia's mother struggled with abuse, substance abuse, and neglect. Felicia and her sister were often left alone, and their basic emotional and physical needs were not met at all. Third, Miss Felicia has experienced multiple losses. First, being removed from her mother. Second, losing her grandmother, who took her and her sister in a year after they went with her. Being separated from her sister and growing up in foster care. All of these disruptions can make it very difficult to develop healthy coping skills. Substances like alcohol and cocaine may become a way for Felicia to, one, numb her emotional pain, cope with stress, get through daily responsibilities, and even sleep at night. All of these are things that she most likely probably did. Substance use. This substance use could have been a survival tool for her, even though now it is causing her harm. All right, so third, I want to speak on the DSM-5 criteria for substance abuse disorder, and whether Felicia meets this criteria. So some important questions that I will ask include: how often does she use these substances? How much does she use at one time? How long has she been using these substances? I would ask whether she tried to stop before and couldn't, whether these substances have interfered with her parenting, relationships, work, whether she has experienced cravings, whether she's continued to use despite these negative consequences. I would also need to know if she's developed a tolerance, if she has experienced withdrawal symptoms, and if substances has become her main way of coping. And this is very important due to her having a DUI. Right. Next, concerning mental health issues that Felicia may also be experiencing. I do believe that Miss Felicia is experiencing other mental health issues, even though they are not stated. They could be present. They are present, and this could be trauma related. This is related to trauma symptoms such as PTSD. And all this comes from child abuse, the neglect that Miss Felicia has experienced, her foster care experience, and last, currently, the loss of her children. So she may be experiencing depression and anxiety also, due to unemployment loss and relationship loss, due to feeling lost, like I said, in hopelessness, the legal trouble that she is experiencing, DHR involvement concerning her children, and last, fearing the loss of her children permanently. These mental health concerns are very important to assess because untreated trauma, depression, and anxiety can increase in a relapse of her substance use, and everything to come.